There was a pretty extensive discussion with regard to the goal of therapy in AL amyloidosis, ultimately what predicts the best outcome. And there are a couple of key points. The investigators agreed that the free light chain ratio, the involved to uninvolved light chain ratio, should not be used as a criteria or an endpoint of therapy because it's too variable related to small changes in the uninvolved light chain. And the recommendations would be that we use the difference, not the ratio, but the arithmetic difference between the involved and uninvolved free light chain ratio. And ultimately, the goal was either an involved free light chain of less than 20 milligrams per liter or a difference between the involved and uninvolved free light chain of 10 milligrams per liter. There was also discussion on minimal residual disease assessment in patients with amyloid. Using flow-based techniques, measuring plasma cells at 10 to the minus sixth, it is possible to classify amyloidosis patients as having achieved MRD negativity. And there was data presenting that MRD negativity both predicted organ responses in the liver, the kidney, and the heart, as well as improved survivorship in those patients that achieved MRD negativity. There were presentations on the role of mass spectroscopy in its ability to define the amyloid subunit. Data was shown that demonstrated that nearly 35% of patients that had mass spectroscopy performed did not have AL amyloid, but had a different form of amyloid. And in those different forms of amyloid, all forms of systemic chemotherapy were contraindicated. And as a consequence, mass spectroscopic identification of the amyloid subunit was recommended for all newly diagnosed patients that have Congo red staining of tissues to define the specific subunit. There was also a presentation indicating that glycosylation of immunoglobulin light chains is a predictor of which patients with light chain MGUS are more likely to develop AL amyloidosis, and that the likelihood of a glycosylated light chain becoming amyloid was greater than a non-glycosylated light chain. So this is something that is almost routinely reported when mass spectroscopic analysis is performed of serum light chains.